Hi, this is Dr. Dana Weary. I'm here to talk to you about an important subject that everybody with a lower back needs to understand. And I talk about this all the time, but it's going to save me some time maybe to create a video for you. First of all, this is not one of the 2 million videos that you've seen about how to sit, but that is what we're going to talk about today. And I think the thing that might make a distinction for you is the why you want to have a good understanding of mechanics and practice some good habits with your sitting. So let's answer that question, why, in the first place. And I'll recount a quick story from a few years ago when I heard an anthropologist speaking, and this woman was talking about how the human frame has evolved over a period of time, but her underlying message was just that we're basically living in the same bodies we would have had 20,000 years ago as hunter-gatherers. And those bodies were designed for regular movement, for regular lifting, contortions, getting into awkward positions, chasing off wild bandits and animals, feeding children, building shelters, basically doing regular nonstop movement in a bunch of different directions. And we're not really built for long periods of inactivity. So the very first thing that's important to understand is that we're not designed to sit or do anything statically for long periods of time. In other words, not moving for long periods of time. Once you start to understand that, then you start to understand how important it is to change what you do throughout the day, and that includes movement. So for sitting, you'll hear all the time, and this is good advice, a kind of standard physical therapy chiropractic approach to sitting, which is about getting a good chair and sitting in a way that allows you to have your thighs at an elevation so that they are level with the ground. Your feet should be under your knees. You should be able to slide back into a seat and assume a normal posture that supports you into here. People will use different pillows and different types of configurations of chairs to get to this configuration, and that's great. But the underlying principle behind that, along with some modifications I'm going to talk to you about, is the importance of being able to keep the lumbar spine in neutral so that the discs in the joints experience the force that they're designed to maintain and support. And also, very most importantly, to be able to keep the sacroiliac joints down into here in a neutral position. So a lot of times when I'm explaining this to patients, I will demonstrate bad posture and explain why that's not a great idea. With this side view here, this is a fairly normal neutral posture here. If I start to slouch like most people do, you got a soft couch, you get tired, you get lazy, you have a bad ergonomic setup, you're not looking at your computer properly. As my pelvis starts to slide underneath, the forces that go through my pelvis and into my lower back start to compress these two large joints. And if you've been a patient in our office, you understand the importance of having good motion in these sacroiliac joints down through here. When I sit in this configuration, they're getting compressed. My body weight's compressing them. And the longer you isolate a joint, especially with pressure, the more likely it is to become restricted. And once it stops moving properly, other parts compensate. The lumbar spine especially will start to compensate with extra movement into here. Your hip flexor muscles can start to develop some tension. As you start to transition into a different way of walking, your gait will change. You'll start to swing the legs out to the side, start to use these hip muscles into here and into here. And you'll start to compensate with a side-to-side motion in your lumbar spine into here that can eventually cause degenerative change or predispose you to injury. So a lot of that trails back to people not sitting properly or for too long a period of time. And it's a common thing for me to ask somebody what happened prior to their most recent episode of lower back pain. And they'll frequently say, oh, well, I was on a plane trip, or I drove to Portland and back. I was in the car for 10 hours, or I had a conference and I sat a lot. I didn't think that meant anything. Oftentimes we'll tie it back to a loss of movement at the sacroiliac joints from that prolonged compression, and especially because they sat with poor posture or in a bad chair. So that's a big part of the reason why we want to preserve normal movement. We want to have normal forces going through the lumbar spine and pelvis, and that leads to this basic understanding that you can do a little checklist with anytime you're sitting. We'll talk about sitting in an office chair as well as driving. With a typical office chair, like I said, we want to be able to sit so that the thighs are at horizontal with the floor. The feet should be, not ideally, but it's an option to have them under your knees, because I'll give you another option that works even better. If you have this normal configuration here at horizontal or slightly sloped downward, and then your hips and your shoulders and your head are aligned from the side, you're reducing these forces that otherwise are required to keep your head upright. If I go into a slouch here, the thing that happens at this end of the spine is that my head has to go forward, and in order to look up, I have to tighten these muscles into here. And these guys are on active duty for as long as they're out of neutral, like this, looking at a keyboard or looking at it over the steering wheel, whatever you're doing. There's a lot more unnecessary tension into here that can start to drive neck pain, headaches, all kinds of challenges with this bad mechanical situation. So simply by getting your hips and pelvis underneath you and getting your shoulders and your chest and your head back and over that, you're maximizing the ergonomics of your spine, the mechanics of your spine, so that these muscles have a lot less work to do, and you can start to hang on your ligaments in a neutral posture rather than have constant muscle tension. To modify that, here's another better way that I like to coach people through. If you'll simply put your feet back, and if you have a comfortable enough seat, slide forward so you're halfway off of it, your knees are starting to point down towards the floor, that position automatically tilts your pelvis and puts you, it maximizes this neutral posture into here. It makes it easier to kind of fall into neutral here. So I don't have quite as much muscular effort to maintain this. If I sit in this otherwise perfect posture, I still have to do a little work to push my chest out, hold my head back. But if I just simply shift forward, let my knees drop down, as long as you don't have a knee issue and you have a comfortable chair that doesn't bite into the back of your thighs, this posture is a lot more advantageous to getting you into neutral and making it even easier to hang out without a lot of muscle activity. Sometimes when you have to do some paperwork, it might be a problem because you're going to start to slide forward. So you just simply put one foot out, the other knee's back, and you can still bend forward, hinging at the hips into here, and still maintain a really good posture for your neck and upper back, lower back, without creating a lot of undue muscular stress and fatigue into here. So play with that idea. Either one or both knees back and down, rock your hips forward, go into neutral into here. That's a great thing to play with as an option for anybody. In a car situation, the part that you sit on in a car is called the seat pan, and that typically is sloped up 5, sometimes even almost 10 degrees, depending on what kind of car you're in. It's tilted up. Part of the reason is to kind of keep you from sliding off as you hit the brakes. You don't go sliding into the dashboard. But sometimes people that are trying to be considerate of their back, they'll say, well, I better have this thing upright to keep me in neutral, when really this is at 5 to 10 degrees and you put this at 90 degrees, you're really sitting at 80 to 85 degrees. So you're almost forcing yourself into a slouch. So I suggest you play with the angle of your seat back by cranking it back almost to a weird angle, almost like it's almost uncomfortable, or just unusual, and put it back 10, 15 degrees. And you might have to slide your seat forward to get to the steering wheel, but play with that, because if you're in this position, you have a lot more back support that kicks in from the passenger seat, driver's seat, and then your head is in a better upright posture. The second aspect of that is to adjust the headrest so it touches you here, so you're not using neck muscles to hold up against gravity here. Ideally, you just want to be in this kind of position here. A lot of people wind up driving like this. So play with the seat back, put it slightly past where you think might be a good angle, and just see how that works for you. The third thing about sitting is, since we talked about it not being good at all for a normal, healthy hunter-gatherer, is to break it up and get up every half hour. You can sit 8 hours a day. You do it safely if you get up 16 times during that day. If you get up every 30 minutes, you might get up and just do a couple of leg swings, maybe like we've talked about in the office. Do a couple of shoulder shrugs, just move. Use that hunter-gatherer body on a regular basis to keep it from getting stiff. And if you follow these guidelines for a neutral posture, understand what compression can do to these joints that can start to drive lower back pain, and take regular breaks, you have a much more successful experience with sitting, both in a car and at home or at work. One last thing, we're not always sitting at work or driving. Sometimes we're just sitting, relaxing at home. You might have a soft couch or a recliner or a lazy boy, and the same principles can apply, both in terms of causing problems for you or in terms of trying to observe a neutral posture, try to create that to help spare your lower back. So it's not uncommon to have a soft couch or have a recliner and to start to shift and slide down into this, and now we get back into that bad configuration down here, and I'm compressing the back of my pelvis through the sacroiliac joints. And I might be doing a good job elsewhere at work or in the car, but now I'm in trouble again. So you don't necessarily have to get rid of your couch or your chair. You've got to get to this configuration somehow. And if you can do that either just by, I could be sitting on a park bench without any support, and I can just put myself into a neutral configuration here just by arching, tightening these muscles here, and lifting away so I get the pressure to the bottom of my pelvis here and not across the back. Or I can stick a couple of pillows into here. I might have my world-class lazy boy that I inherited from my grandfather. I might just have to stick some pillows into here, and now I'm safe. This would be bad. This would be pretty safe. The principles about taking breaks still apply. You still need to get up from the couch or the chair every half hour just for 10, 15 seconds, just to feed that hunter-gatherer body. It wants regular movement. But if you'll observe those rules, it'll make a big difference for you long term, and it'll help to preserve the effects of the treatment that you get in our office. So I hope that that's helpful. If you got questions, please bring those up. I think this makes a huge difference for people that have chronic lower back pain because I see sacroiliac joint problems as the cause for so many of those conditions. And this is part of maintaining that mobility once we get it reestablished.